Have you ever woken up to find your bedsheets or pillows soaked in sweat? It might seem harmless, especially if it's warm at night or if you're bundled up in blankets. But what if this happens frequently, without any clear reason? It could be your body's way of signaling something more serious. Early detection of cancer can make a crucial difference between a successful treatment and more complicated outcomes. But how can we identify these early signs? Aside from regular screenings for cancers like breast and colon, it's important to be aware of subtle symptoms your body might be showing. Things like unexplained weight loss, persistent fever, or extreme fatigue are red flags that shouldn't be ignored. However, there's one symptom that can literally appear in your bed. So, what should you be looking for? You might wake up in the morning and find your pajamas or bed sheets damp or completely wet from sweat. Now, if it's a hot summer night or you've wrapped yourself up in heavy blankets, that's completely normal. But when you can't find a reasonable explanation like the temperature of the room or your sleep environment, it's important to take note of this symptom. Why do we sweat excessively at night? Night sweats can be caused by a variety of things. It could be a normal response to the environment, hormonal changes, or even infections. But what many people don't know is that night sweats can also be an early sign of certain types of cancer. For instance, some types of cancers, especially lymphomas, a cancer of the lymphatic system, can cause excessive sweating at night. Lymphomas affect the immune system, and one of the ways your body responds is by overheating and releasing excessive sweat during sleep. Lymphomas and night sweats. Lymphoma is a type of cancer that affects the lymph nodes, which are crucial in helping the body fight infections. When these nodes are attacked by cancer, the body reacts in various ways, including fever, weight loss, and in some cases, night sweats. The body essentially overheats as the cancer progresses, and the result is intense night sweating. Though Hodgkin's lymphoma and non-Hodgkin's lymphoma are the most commonly associated with night sweats, they aren't the only types of cancer to watch for. Other cancers that may cause night sweats. In addition to lymphomas, cancers like leukemia, prostate cancer, and breast cancer can also lead to this symptom. In many cases, it's not the cancer itself, but the treatments, such as chemotherapy or radiation therapy, that can trigger night sweats. Even after the treatment has ended, some people find that their night sweats persist for weeks or months as their bodies recover and adjust. Additionally, tumors that produce excess hormones, such as pheochromocytomas or thyroid cancers, can lead to hormone imbalances that cause sweating. These tumors can cause sudden surges in hormones like adrenaline or thyroid hormones, which may result in not only night sweats but also other symptoms like rapid heart rate, high blood pressure, and unexplained weight loss. For instance, pheochromocytomas are tumors that form on the adrenal glands and cause the body to produce excess adrenaline. This leads to episodes of fight or flight responses, one of which is excessive sweating. Similarly, thyroid tumors can accelerate the metabolism, leading to overheating and night sweats. The role of stress in night sweats. It's important to also consider the psychological impact of night sweats. Chronic stress, anxiety, and even panic attacks can disrupt the body's natural temperature regulation. When you're in a state of heightened stress, your body releases cortisol and adrenaline, which can raise your body temperature and trigger sweating. For people experiencing post-traumatic stress disorder, PTSD, the frequency of night sweats may be even higher due to the constant fight-or-flight response their body endures. Mental health and physical health are closely connected, and sometimes simply managing stress levels through meditation, therapy, or relaxation techniques can reduce the frequency of night sweats. Recognizing this connection can provide relief without needing medical intervention in every case. Other medical conditions. There are other medical conditions that can cause night sweats beyond GERD, which was mentioned earlier. Obstructive sleep apnea is another common condition. It involves the repeated stopping and starting of breathing during sleep, which can disturb sleep patterns and increase body temperature, causing sweating. Proper treatment of sleep apnea, such as using a CPAP machine or making lifestyle changes, can help manage these symptoms effectively. The impact of diet on night sweats. Sometimes what you eat can play a role in nighttime sweating. Caffeine, sugary foods, and processed foods consumed late in the evening can affect your body's hormone levels and increase your core temperature. For instance, caffeine stimulates the central nervous system, leading to increased heart rate and sweating. Similarly, spicy foods contain capsaicin, which can cause temporary increases in body temperature, contributing to night sweats. To reduce the likelihood of night sweats, it's a good idea to avoid these foods and opt for a lighter, more balanced meal before bed. Environmental factors. The conditions in your bedroom can also affect night sweats. A poorly ventilated room, excess humidity, or even the type of bedding you use can trap heat and cause sweating. Consider using cooling mattresses, temperature-regulating pillows, or moisture-wicking sheets to create a sleep environment that promotes a stable temperature. Proper room ventilation and setting the thermostat to a cooler temperature can also help prevent overheating during sleep. How to track and monitor night sweats. It's often helpful to track the frequency and intensity of night sweats for medical purposes. Keeping a journal that notes when the episodes occur, along with any accompanying symptoms like fever or fatigue, can be a useful tool for doctors trying to diagnose the underlying cause. Recording details such as diet, stress levels, or any changes in medication can provide a clearer picture of what might be contributing to the night sweats. Hormonal therapy and treatment options. For those whose night sweats are hormone-related, such as in menopause or low testosterone, there are several treatment options. Hormone replacement therapy, HRT, can help balance hormone levels and reduce symptoms like night sweats and hot flashes. However, it's important to consult with a healthcare provider to assess the risks and benefits, as hormone therapy isn't suitable for everyone. For men experiencing night sweats due to low testosterone, hormone therapy may also be an option to explore, though the treatment needs to be carefully monitored. When to take action. While occasional night sweats are often normal, it's important to remain vigilant. If you have a family history of cancer or chronic illness and begin experiencing persistent night sweats, it's worth consulting a doctor. Being proactive, especially when it comes to your health, can make all the difference in early detection and treatment. When should you see a doctor? It's important to keep in mind that while night sweats can be a sign of something serious, they are often caused by something much less worrisome. However, if your night sweats are accompanied by other symptoms such as unexplained weight loss, fever, or persistent fatigue, disrupting your sleep on a regular basis, occurring alongside pain, particularly in the lymph nodes, or other areas of the body, or happening even when the room is cool and you're not bundled up in heavy blankets, then it's a good idea to consult with a healthcare provider. They can help determine if there's an underlying cause, and if necessary, recommend further tests to rule out serious conditions like cancer. Night sweats management. Managing night sweats can often involve simple lifestyle adjustments. As mentioned earlier, ensuring a cooler sleep environment, wearing lightweight pajamas, and reducing alcohol and caffeine intake can make a noticeable difference. Regular physical activity and maintaining a healthy weight can also help improve overall metabolic and hormonal function, which may reduce the occurrence of night sweats. If lifestyle changes don't seem to help or if night sweats persist, it's important to seek medical advice. Monitoring the duration and severity of your symptoms will help your healthcare provider determine the best course of action. Night sweats, while unsettling, are often manageable and can result from a range of causes that are not life-threatening. Staying informed and mindful of your body's changes is key to maintaining your health and well-being. If you think your loved ones could benefit from this, share it with them on WhatsApp or other platforms. You never know whose health you might improve today. Take care, and I'll see you next time.